Well, calls for change this afternoon in the shadow of City Hall. I heard from advocates and elected officials as they stepped up one by one, seeking a new approach to responding to mental health crises.
What do we want? Peace, not police! When do we want it? Now!
Officials and advocates taking on mental health today, and their message was clear.
What we need to do is look at how do we either improve that program or come up with something new.
The program in question is the Behavioral Health Emergency Assistance Response Division, or BHERD. Launched last year in Harlem and Washington Heights, it has since expanded to more of Manhattan and the Bronx, and is part of the city's effort to treat mental health crises as a public health problem rather than issues of public safety.
It's supposed to be a non-police mental health crisis response, when in reality, 84% of all of the calls actually go to police.
For too long, people who are experiencing a mental health crisis have been encountered by a law enforcement response. 19 people have been killed in those encounters over the last 7 years.
One of those people was Miguel Richards, who was shot and killed in the Bronx 5 years ago by officials performing a wellness check. You're looking at body cam video of that night that was released by the NYPD not long after. Now, Richards' family and their attorneys in attendance today, along with advocates from CCIT NYC and NAMI NYC, who believe peers or people with a mental health condition or background would be a better choice.
Most of them have been trained in crisis intervention. We need people who really understand these issues, because who understands it better than someone who's undergone crisis themselves and made it through on the other side?
And advocates today also telling me they're asking for the program to increase its coverage as well as its hours of operation and asking for more funding.